In today's Wellness Wednesday, October marks Breast Cancer Awareness Month, meaning there's no better time to make sure you are educated about the disease and your possible risk factors. Joining me with those facts is Dr. Rihanna Menon from St. Luke's. Doctor, good morning. Thanks for being here.
Good morning. Thank you for having me.
Of course. First question for you. Can you give us just a little overview of breast cancer and what people can expect when they're diagnosed?
Sure. So that's a huge topic, but about 1 in 8 women will be diagnosed with breast cancer. That's about 12% of women. So it's incredibly common. It is also incredibly treatable. But what I tell women is that I don't have X-ray vision in my fingers. And so one of the best ways that we can be really effective at treating breast cancer is catching it early. So for Breast Cancer Awareness Month, everyone go out, and if you're due for your mammogram, get it.
Gotcha. That's good advice. And you have 5 things you talk about with patients. What exactly are those, and why are those so important to know before a diagnosis and even after beating breast cancer?
Yes. So the 5 things I talk about for women, both who are in the process of fighting it, talking about recurrence, or trying to avoid getting it in the first place. The first one is really diet. About 30 to 40% of all cancers are associated with an unhealthy diet. And so I really advocate more of a plant-based diet. That doesn't mean everyone needs to go out and become a vegetarian or a vegan, but it's really about what we add in. Lots of fresh fruits and vegetables, varieties of fresh fruits and vegetables, nuts, especially raw tree nuts, and then whole grains. And so it's not really about what we aren't eating except for those processed foods. If we can avoid processed foods, processed meats, processed sugars, what I kind of say is eat like you live on a farm. If you can make it at home, that's a good thing to eat. That brings us to obesity. About 1 in 3 people in the US is considered obese. And we can't just exercise our way out of this. About 80% of obesity is linked to diet, with only 20% with exercise. So really avoiding those high calorie, cheap foods like sodas and added sugars are a great way to prevent breast cancer. The next one is exercise. So we don't all have to get out there and be marathon runners. Even 3 to 5 hours a week of just walking is specifically great for breast cancer prevention. And the next one is really important, and it's alcohol. There's a lot of emerging evidence about how dangerous alcohol is in breast cancer. So even 3 drinks a week increases your breast cancer risk by about 15%. And none of us think that's considered heavy drinking. So really trying to get down the amount of alcohol that we use. That doesn't mean none, but that means a pattern over time. And the last one is thankfully easy. If we all just get more sleep, that's associated with a decreased risk of breast cancer.
Gotcha. All good tips. Okay, we're just about out of time. So, of course, we're still in the COVID-19 pandemic. Could you really quickly just tell us what exactly that means for regular checkups and mammograms?
We're back to our regular screening schedule. That may change with the pandemic, but go ahead and get out there and schedule your mammogram.
Perfect. Okay, easy enough. And where can people go if they have more questions for you?
You can go to the St. Luke's website, or those national websites like breastcancer.org, the Komen Foundation are all really great sources of peer-reviewed information about breast cancer.
Perfect. Okay, my guest today has been Dr. Rihanna Menon from St. Luke's. Thanks so much for being here.
Thank you for having me.